Hello everyone, it's Dr. Rafael Gutierrez. Today I'm going to do part 3 of the benefits of kata, and this really does play with what I talked about last time about using collaboration for kata. Now, I did break this down into 3 parts technically, or technically 3 things that I would like to address. And one of the things I would say is if you are able to work with other people when you're dealing with this, it really would help you out because not everyone can learn everything about everything. And so by being able to go to people who are more specialized than you, you can actually see the why you might want to try something a little different. Now, I am lucky. I do work in academia, so I do have colleagues who have doctorates in kinesiology or physical therapy. Uh, I myself teach anatomy, clinical anatomy. Uh, I have access to a lot of different people and people who have certificates in different areas. And so that does help me put everything together. And that's actually how I did start looking at this. I did ask a lot of people how they use kata and saw that some people use this as well. And one of the things I would actually mention is there are 3 things that kind of play in when you're dealing with how you can use kata to benefit. And one of them is decrease long-term injury. Now, a lot of people do end up having injuries because of use, and I'll talk about that later. I'm also want to talk about how you can actually use the body mechanics kinesiology to increase power. So pretty much when you're actually trying to develop damage to a target, that's what I'm talking about increasing the power. In the decreasing long-term injury, it's just that by doing the movements properly, you may actually decrease that, and you may actually also be able to strengthen the usage of everything, and I'll mention that later. And the last thing is improving the techniques. So these are the 3 physical aspects that I'm going to talk about benefits of kata in this one. Now I would tell you if you are thinking of using this for best results, talk to a DPT, people with degrees in kinesiology, and someone who understands strength and conditioning, especially if someone has these certificates in it. Now this is a image I stole from Facebook because I've seen it a lot. Now it says anatomy of a martial artist over 40. Well, I'm a few months away from being 50, and because of the way I train and what I've found out from other disciplines, I do not have any of these. Uh, I don't have shoulder pain, biceps pain, neck pain, uh, any of these. And part of the reason is I'm actually looking at what people do that injures them, and then also taking it to this next step, which is there anything I can do to prevent the injuries, especially as I get older? And so one of the things I actually will talk about is there are 5 really common disabling musculoskeletal pains. And most of these are actually are actually pain in pretty much in any joints, as you can see here. And these injuries are usually caused by either overuse, trauma, misalignment when you're actually moving around. If you don't have the proper alignment, you're going to damage your body, or forcing a joint to go beyond the normal range. Now, one thing I will actually always point out, and it's something that the orthopedic surgeon I had a chance to study under used to say, pain is your body's way of telling you that you're doing damage to yourself. If you feel pain, you need to pull down. Now, the other thing I want you to know is not all pain is from injury. So if you have some chronic pain, always consult a medical professional so you can actually take care of the problem. Now, the problem with a lot of the things I'm going to talk about, the 5 most common, is these are problems that are going to eventually lead to decreased activity because, well, if you cannot move because of pain, it's going to make it so you can't do what you want to do. And so a lot of the things I'm going to talk about will help you actually prevent most of the things you have here. Now, I always tell people I'm almost 50. In 2 months, I'll be 50. And I don't have any of these issues. Part of it has to do with my height. Depending on who I ask, I'm anywhere between 5'8" to 5'10". Uh, I have actually lost a bit of weight, but was morbidly obese, which will actually cause pain in certain areas like your back, your knees, your ankles. Uh, as I did drop the weight, I went from 230, 240 to 180. It actually will change how you move and the trauma to the body because of normal activity. And so that's one of the big things to look at is it's not just a how you train, but other aspects will be affect you. For instance, if you're extremely tall, chances are you will end up developing back pain eventually. Now, the things I'm going to talk about pain-wise is back pain. And what we find is about 80% of people will eventually seek medical help for back pain, meaning out of 100 people, 80 of them, out of 10 people, 8 of them will end up having to go to a medical professional to try to figure out how to fix their back. Now, back pain is linked to a lot of things, and I'm going to deal with mainly things dealing with mechanical issues. You can get autoimmune diseases, you can get car accidents, which happen. Some anatomical variation can occur, but there are things that are actually linked to back pain. One is poor posture. And this is actually going to be important because a lot of times when we're doing uh, physical activity, we don't necessarily pay attention to our posture. We're told, oh, well, you're supposed to be a certain way, and we follow it rather than looking at how your body should, especially your back, should move. Another thing that I mentioned is obesity is linked to back pain. I was lucky enough not to actually have my obesity cause back pain, but I do know a lot of people who do end up having it. Trauma, if you get hit, if you jump a lot, if you overuse of stuff, you can end up having back pain. And one of the main causes of pretty much any type of pain is overuse. Now, it has been suggested that a weak core and hip muscles are a cause of back pain. And it does make sense because if your core is weak, you may not actually maintain the right posture. And that is one of the big things for, again, back pain. Now, there is something I'm going to talk about which is actually interesting. There was a report which I actually put the article here. It was from Medicine, the medical journal. And what they actually found is that lumbar stabilizing exercises and walking can be recommended to relieve back pain and prevent chronic pain. And so, stabilizing the lumbar area, using that to maintain the right posture, and walking can actually help prevent chronic back pain. Now, what does that have to do with Kata? As we move on, it will become more apparent. Now, going down from back, we have hip pain. About 10% of the general population will have some sort of hip pain. Hip muscle strength is an important factor that indicate and an indicator of physical functioning, and it actually is at risk. It actually has it is at risk of declining as we age. Now, one of the things that they found is when you have all the muscle of the hip are involved in gait, which is how you walk to maintain your balance. So if you actually have the hip muscles at the proper strength, chances are you'll be able to walk more. You'll have proper gait and you won't lose your balance as much. So having all your hip muscles strengthened will actually help in longevity. It also has been linked the hip issues with not having this right strength with hip pain. There is also stretching and keeping warm. Again, and one of the big problems with pain is a lot of times it is caused by overuse. And again, moving down, knee pain. About 25% of adults will eventually complain of knee pain. And one of the things they found is simple home-based exercise therapy can produce significant reduction in knee pain. Meaning if you go to a physical therapist, they can actually give you a exercise therapy that you can do at home and it will prevent knee pain if you have it. It will actually significantly reduce it. Now, if you actually maintain the muscles the right way and don't damage your knees, if you actually maintain the right alignment, it should help prevent knee pain for a while. Now, I'm going to skip ankle and I'm going to go to shoulder pain. Now, 25% of the US population will have some sort of shoulder pain. And one of the things is, depending on the type of shoulder pain we get, a lot of times exercise alone can't actually fix it if done properly. And that's a big thing. It has to be done properly. Now, one of the things I've noticed is many of the physical therapy shoulder exercises that they give you to stabilize the shoulder actually require you to pull your scapula, or your shoulder blade, back and down. Now, the interesting thing about that is if you pull your shoulder blade back and down, it will also help promote the right posture and also decrease back pain with that. Usually these types of pains are caused by overuse. And so we have to use something, but we do have to use it. We have to make sure we're not damaging ourselves. The whole idea of no pain, no gain that some of us were actually taught in high school is something that we should throw out and start looking at what kinesiologists are actually telling us. Now, when we're dealing with physics, when we're dealing with power, we actually have to talk about what power is. And so you have a little physics. Power is pretty much a unit of how fast energy is transferred. And so P, power, is equal to energy divided by time. What that means is the amount of energy that gets put into something in 1 second is pretty much the definition of power. The more time it takes that energy to be transferred, the less power you end up having. Now, power can also be seen as a aspect of force. It's usually force times velocity, P equals FV. So pretty much power is how much force you're producing based on the velocity that's moving. What that means is the faster something's moving, the more power it'll have. If you think about it, you can actually have something that's really has a lot of force, but it's moving really slow. And so if it hits you, it will not cause a deformity and just move you along. While something that may have a smaller force but a really fast velocity may not move you, but it's going to cause massive deformities. If you think of, say, a projectile hitting you, a baseball, for instance, it may not have a huge amount of force necessarily, but the velocity is what's going to end up doing the damage. It's going to break bones. In a collision, what we find is the faster the force is transferred, the more likely we have deformity in the object that's struck. So to get more force, though, there are certain things that are important. And like I said, I don't want to deal too much with anatomy because I talk about it all the time, of course, my job, and I actually do enjoy it. But to get more force, that F over here, we need to use stronger and larger muscles. Now, what that means is, if we look at a human body, the strongest and largest muscles we have are going to be found on the legs. So if we want to develop the maximum amount of force, and we'll deal with velocity later, you want to use muscles in the legs. And what you're going to use the muscles of the legs is pretty much the muscles of the thigh to rotate the hip bone. Now, by using those muscles to rotate the hip bone, you're going to end up developing a lot of force. And a lot of times that force isn't necessarily going to take a lot of time to develop. So you're going to end up being able to get explosive forces with these. Now I wanted to just to show you how big the muscles of the legs really are. And over here you can see the os coxae. I actually have the muscle here. And I did borrow this from KenHub. I highly recommend anyone who's interested in human health, how the body moves, to actually get it so you can actually see the human body, and they do have a lot of things to help teach you anatomy. Now, if you look at the bone here, you'll notice that it's actually not that thick. It would probably be, in someone like me who, like I said, 5'8", 5'9", 5'10", would probably be about the size of a silver dollar. So think of about 4 centimeters in diameter here. Now, if you take your leg and assume that your femur here is 4 centimeters, you'll notice that there's really a lot of meat around here. This meat is a muscle, and so you can see how all these muscles here are going to end up helping you pull. And a lot of people think, oh, well, it's going to be this muscle or this muscle. Now, what we actually have found is the largest muscles, the ones that develop the most force, would be these here, which are called your adductors, your gluteal muscles, which are the back, and your quadriceps muscle group here. So if you can use all those muscles to pull and cause a rotation of the os coxae, you're going to have a massive amount of power, of force, which will transfer into power. You also will use this iliopsoas. Now, a lot of times we don't pay attention to the muscles we're using, and when we don't do that, we actually a lot of times don't use them. And so one of the things I'm going to mention is when you're doing the kata for strength, fixing your hips, fixing your back, or for power, for force, and you're thinking about it, you will actually feel some of these muscles actually start getting more sore. Now, the other muscles I'm actually going to mention are the muscles of the rotator cuffs. Now, a lot of times people talk about the deltoid, which covers all this. It's a big muscle, but it really isn't holding the glenohumeral joint. And when people end up overusing or misusing or tearing, and you hear someone get a rotator cuff tear, it's one of these 4 muscles called the rotator cuff muscles. This green one here is the supraspinatus spine, so it's above supraspinatus. This one here is the infraspinatus. This one here is teres minor. These three are three of the rotator cuff muscles, and again, remember, they're deep and they're small muscles, and to exercise them, you actually require less weight than if you want to actually build up your deltoid. Underneath it, if we flip this around, we have something called the subscapularis, which is the 4th rotator cuff muscle. You do see a muscle here called the teres major. For the rotator cuff, it's not that important. These are the ones that are more important. And we can actually strengthen them by certain exercises that uh, physical therapists can teach you. Uh, and so these are actually the muscles that you're actually looking, but these aren't the only things that stabilize the shoulder. A lot of times when we're talking about stabilizing the shoulder, what we're really trying to stabilize is the bone here, which is your scapula or your shoulder blade. And for that, I have 2 images. There's 2 muscles that are really important for that. One of them is this muscle here, which is a triangle-shaped muscle, and it would be paired on this other side, giving you a trapezoid-like shape, so we call it a trapezius. And muscles pull in one direction, but you have muscle fibers that can pull in different. So this muscle here can pull up and back. This area here can just pull back, and this one here back and down. So if you're using the inferior, pretty much the inferior belly of the trapezius, you're pulling your shoulders back and down. The other one, you can see the sternum here, the scapula here, and the rib cage here. And you can see this serrated looking muscle. And it's called your serratus anterior, and it is here attached to the inferior angle of the scapula. They would be coming from here to the ribs here. And what this does is it pulls the shoulder blade forward and down. And if you activate the serratus anterior, this one here, and the trapezius together, it pulls the scapula back and down. And interestingly, that does give you a major support to the shoulder. A lot of us who train in karate have probably been told a million times to bring our shoulders back and down. And that's one of the reasons. It actually will help protect your shoulder to a degree. But the other thing we find is, as it does come this entire length, a lot of times when we do activate those muscles, it actually puts our spine in a better alignment. And so that's one of the important aspects of training when we do kata is think about the serratus anterior and the inferior belly of the trapezius to help support our shoulder and avoid a lot of the shoulder injuries that people will end up getting. Now, like I said, there were the three goals, and the three goals that I wanted to look at is strengthening muscles to prevent injury. Second one is to use kata and modify it based on what a physical therapist might tell you to end up decreasing injuries. And the third one to develop power. And these are actually interrelated. And so just to show you what I'm talking about, I'm going to use a kata from the Shuren Rus called Fugata Ich. And, and I'm going to show you a way to do it slow and how you can use these three goals. So let's start by getting in. If you know Fugata Ich or you watch someone do it and you start at the beginning, you can slowly bend your knees, dropping your weight and shifting your weight to the right leg. Once all your weight is in the right leg, you can use your left leg to reach out. Decide where it's supposed to be, touch, land your foot, and slowly shift your weight again while you rotate your hips using your adductors and gluteal muscles and thinking about it and trying to feel the contraction. Now, as we're doing this, there's a couple things that happen. First is, as we're dropping our weight, we do have something called the eccentric contraction of the extensors on the right leg. And by doing this, it helps us improve our balance. It's not just I'm going to get more power, but you're actually improving your balance. And there are some exercises that you'll see strength and conditioning people teach, which is similar to this. Remember, when you are doing this, though, to use proper body mechanics to make sure that you're not causing more pain. And if you are causing pain, pull up. Remember, never go beyond where it starts causing damage. If it starts causing pain, you're going too low. Now, as you reach out and shift your weight, there's actually an exercise in PT called target stepping. They have found it does help improve your gait. It is used in usually seniors who have lost the ability to walk. So if we start using this initially, we are getting the strength to increase our balance. We're already doing the target stepping, which will improve gait, and we're getting the muscles of the hips more powerful so we can develop the power in there. Now, as we shift our weight and slowly rotate for the lower block in Fugata Ich, we actually will be holding our shoulder blades back and down. This will actually give you an isometric contraction of the trapezius and serratus anterior, which will help strengthen and protect the glenohumeral joint, the shoulder joint. This also will, like I said, help maintain proper posture, and so you will be less likely to end up getting back pain. Now, the other thing is, while doing the moves, you should be breathing out. And when you breathe out, you should be tensing your abdominal muscles and trying to maintain the natural spine, natural curve of the back. If you are going, if you are over exaggerating it, if you're pretty much over curving or under curving, you can end up causing back pain just by having the wrong posture. Now, by breathing out and really contracting the abdomens and attempting to maintain a natural spine, it actually ends up leading to the lumbar stabilization exercises that you can begin. There are others, and if you have back pain, I recommend going to a physical therapist so they can give you the right exercises for your back pain. Not, and also to check your kata to see if you're actually using the proper alignment so you don't cause more damage to yourself. Now, one of the big things that I'm actually mentioning is by doing katas this way, we actually do reach our three goals. First is we decrease long-term injury. By doing it slow, we actually do decrease the impact of kata. A lot of times people will jump and they'll move quick and they'll actually do damage to themselves because they don't twist right and they'll rip ligaments and tendons, rupture muscles. By doing it slow, we can actually get the proper function, the proper alignment, and increase our normal posture, pretty much decreasing all the long-term injuries that I talked about earlier. By doing it slow, we're also doing a couple things. One is we're working on the powerful muscles and making sure that we are using the right muscles, the more powerful muscles for the technique. And so by moving slow, by actually looking, and asking yourself every time, am I using all the muscles I can to rotate my hips? You're actually going to increase your power. It can also help put the breathing in right. If you've done boxing or you've actually played any sports or you've gone to weightlifting, a lot of times people will tell you you're not breathing. By actually slowing down your kata to a point where you're forced to see how you breathe with each movement, you can start incorporating your movement and have your movements and breathing end up becoming pretty much linked, so you don't hold your breath as you do kata and as you end up using your kata. Now, as you are using slow movements, the other advantage is you can ensure that the techniques that you're doing are done properly. Not just the alignment of everything and looking at, am I damaging my body, but also looking at, are you pretty much going to end up getting your arm to move out in a straight line, or is it going all akimbo? And so that's one of the important things that's important with the improving techniques. Doing it slow and looking at every movement, every muscle that you may want to do. Now, there are a couple things I'm hoping that you'll remember from this. One is, if you are in chronic pain, get evaluated by a medical professional prior to any physical activity. Like I said, if you have chronic pain, you may end up being the cause of your pain. And if you don't fix what you're doing wrong by someone who knows how your body should move, you can actually end up losing even the ability to walk. Number two, I want you to know is pain is your body's way of telling you that you are probably damaging something. So if pain begins, stop, pull back. Also, if you are constantly having pain, go to number one, get checked and evaluated by a medical professional. And when I say medical professional, I mean someone who is licensed, practicing, and actually can prescribe and tell you you're doing this wrong. And listen to them, because if you are doing something wrong that's continuously breaking your body down and you just say, well, that's the way I do it, well, when you end up not being able to walk, it's going to be an issue. The other thing that is important to remember is if we are modifying techniques in a kata to prevent injury or decrease pain, it again is important to work with a professional who actually has studied this. A lot of times people think, well, I know because I magically know. If you go to someone who has a certificate in strength and conditioning, they've actually studied enough to understand how the body mechanics work to avoid having you injure yourself. If you go to a physical therapist, they've gotten a doctoral degree to understand what you're doing wrong and how to fix your body. Orthopedic surgeon, again, this is not well, I'm just going to learn it naturally. It takes a lot of time. And so, unless you have the time to get a medical degree or a doctorate of physical therapy, really, if you're modifying the techniques, make sure you pretty much talk to a professional, especially if you already have pain. If you don't have pain, well, you may be able to get away with it. Now, the last thing I'm going to mention is I will be doing a presentation on clinical implication of Kyushu on August 24th. If you're interested, contact the International Neoclassical Karate Kabuto Society, and they will tell you how to be a part of it. While I do these seminars, it won't be just me talking, showing you a PowerPoint. You will be able to ask questions. I hope you enjoy this. I hope you got something good out of this. And the next part that I'm going to do on this kata series is actually going to be on meditation. One of the things I'm hoping you notice is each one of these actually can help get you to the previous one. If you're thinking of mindful moving slowly, making sure you're working on your breathing, these are the same things that people tell you about when they're dealing with medication. I hope you enjoy this and have a nice day.